Good morning, everyone. I hope you had a restful 3-day weekend. Um, it was an eventful week last week. I think you may have gotten a flurry of action alerts as we saw the reconciliation bill move from draft to different draft and evolved drafts until the Senate passed it on Monday, and then the House turned around and passed it on um, I believe Wednesday last week, and in between the two, we had a state budget that got done. And then the bill was signed last week, Friday. So we are 1 week out from this bill that we have been talking about since January becoming law. And I'm going to start us with the good news and all of the things that I think will be important as we move forward because our work is not done and we're not going away. There are some things that we know in the bill, and there are a lot of things that are unclear and will be continue to be subjects of argument and debate and decision making in the months to come. And the good news is all of those little decisions are things that advocates can have a lot to say about. And we'll talk about some of the other things that may be on the horizon as well. So, starting with the good news, because there is some. The Wisconsin state budget was signed before Congress enacted this bill. And that's important for a couple of reasons. First of all, that state budget included a $1.4 billion increase to Wisconsin's Medicaid programs. And that was the cost to continue doing what we do now for the next 2 years. So the legislature and the governor said, okay, we're going to start with a base of funding that we think is enough to keep running things as we are now until the next budget. And then, if things change and evolve from the federal level, we will make decisions, but we're not going to, cut our Medicaid program before we know what's coming from the federal government. That's a big deal. Part of that cost to continue included the minimum rate band for certain home community-based and facility-based long-term care providers. That does not include everyone. I believe 1 to 2 bed adult family homes were not part of that original rate band. Some employment providers were not. So it wasn't a complete reflection of everybody we know is important to continuing our home and community-based system. I will just note that our organization was always in support of including everyone in those minimum plans, and that was an advocacy thing that we were not successful on a couple years ago. And so while it is a success that the minimum rates that was put in continues, I want to recognize also that it doesn't continue everybody. And you can kind of see when you have an advocacy loss that didn't work out, sometimes that loss carries forward. That's also true of advocacy successes. So just remember that as we continue. And the budget also included some uppers for some pretty important Medicaid rates that are important to older adults and people with disabilities, and especially the home and community-based service system, home health, personal care, and certain private duty nurses. The other thing the budget did, if you've been attending these presentations, you've probably heard us talk about provider taxes and the desire for the reconciliation bill to change what states can do. We got in under the wire. Wisconsin had increased that provider tax to the maximum level it could before Congress signed the bill. So that means we pulled in, and I could be wrong on this figure, more than $1 billion for hospitals, by doing that change now. And it won't offset all the things that are going to happen, but What that means is that we are now in the best position Wisconsin can be in with a funded system and having maximized the amount of dollars that we can come in through provider taxes to be able to kind of face the future and figure it out from here. It's really important that that Wisconsin didn't cut its current Medicaid programs now, because we know there are multiple parts of the federal bill that we will talk about later that are going to create state budget shortfalls, and they are going to create costs that states haven't had to pay for before. So again, that's another budget problem for states, because if you have costs that you didn't expect, that means it's not in your budget. And that boosting of funding before we have to make cuts is important. It may help soften some of the decision making that is coming. The other really big thing for our state is that our current governor and our current Medicaid director do not want to see people lose healthcare coverage. So we have an administration who is thinking from the frame of, what can we do to make sure that we can do our best to do the least amount of harm? That isn't necessarily true in other states. There are certainly other states that may make very different decisions. They may be more indifferent as to whether people lose coverage or not. They may actively want to cover fewer people in Medicaid. They may not have the money to make the investments in systems that would help them do the best job that they can. And Wisconsin is not that state. We are already doing a good job in a lot of areas in terms of eligibility, in terms of the workforce that we have at our counties that are diligently helping people, trying to figure out, what programs they qualify for, and really working through individual situations with them. And it is a credit to our state that they want to make sure that Wisconsin is only doing what we have to, and we're going to try and make changes that affect the smallest number of people possible and not make things harder than they need to be. Because some of the changes that we're going to talk about are designed to make things harder for people with the express intent that people won't be able to do it and therefore lose their coverage. So that's two good things. The other thing that we're starting with that is not true again in a lot of other states, we have a very strong Medicaid program that we have invested in over decades. So Wisconsin has decided that home and community-based services are a way to go, and they have built out over 30 years a system to do that with. We have care infrastructure. Now, advocates and people who work in that system and people who use that system, I think we could all agree we'd like to see some things different, and we are at a place where maybe we can evolve them into a thing that works better. But many states aren't starting from that point. They are starting with waiting lists. They are starting with provider shortages. They have the same care worker shortage that is affecting all states. And that puts them in a very different position in terms of impact on the people who need those supports, if they're already starting with a system that doesn't cover what people really need in their community. We have a lot to lose. But the other advantage we have is we have a tremendous number of people who are being helped by our Family Care IRIS and CLTS and other Medicaid programs, as well as a lot of folks who are small businesses who provide those services to people and understand the challenges that their clients have in getting what they need. And we also have a robust system of county workers, including disability and aging benefit specialists and our ADRC friends that really do a lot of the unseen work to make the system move as it does right now and understand the scenarios and the people that are coming into their doors for help. All of that is great news because part of what we're going to need to do from now until who knows is to help people understand how difficult our current system is and what the barriers are, and why Wisconsin needs to be smart about making decisions that help make that system that's hard now easier, especially as we think about having to potentially add more work and more workers who need a certain level of expertise to really implement changes. It will be important for our state legislators to really have an understanding, not only from people who participate in the program, and that is they have a big base of people in every single legislative district who are touched by Medicaid. That experience is really important to state legislators, as is the experience of the county ADRC and county workers who are, right now, the ones on the front lines helping people determine whether they're eligible or not, helping folks understand what documentation they need, verifying, interfacing with Social Security, doing all of the things that I think a lot of legislators aren't aware is going on. And I also don't think they're aware of how successfully Wisconsin does those things. That's going to be critical because at some point, it is likely Wisconsin is going to need to ask the legislature for more money to improve systems or have more workers to successfully implement some of these changes. And doing a lot of this, the education now to help them understand why those investments are so critical and why they are so important to not only more people being able to easily keep their healthcare coverage and why keeping their healthcare coverage is actually good for the rest of our healthcare system, and communities that are paid by Medicaid dollars. That'll go a long way as we have to kind of continually revisit over the coming years, really, what we are doing and making the good decisions that ultimately will help us be successful. From the point of people being able to apply and get through and get into Medicaid in a timely fashion, in an accurate fashion, and be able to renew their coverage. We do have a lot of folks that have registered who are from other states. So a lot of this information will be relevant to you. However, I just want to remind folks from other states that there are many provisions in the reconciliation bill that don't impact Wisconsin because Wisconsin is one of 10 states in the nation that did not expand Medicaid under the Affordable Care Act. So there are many provisions in the reconciliation bill that are specifically targeting states that have expanded Medicaid. Many of those do not impact us, or they impact us less and differently. And I just want people to be aware of that because we're not going to cover everything that's in this bill. We've kind of selected the main things that I think will need a continuing discussion over the coming months. And the fourth thing is we have the very best people. Let's just be frank about it. Many of you have spent months doing all the right things. You have been tireless with sharing your stories and very honest about your situations and experiences and asking questions and saying things in shorter and shorter words to your elected officials. They didn't listen. They should have. That's not your fault that they didn't listen. And there's a lot of things that we can do now that can not only change um, lawmakers' opinions, but hold them accountable for their decisions and push them to make different choices in the near future. So you have done a tremendous amount of work that we should honor. And even though we were not successful in getting everything out of this bill that we thought was harmful, we did a lot of work to prevent even worse ideas from getting in, frankly. I know that doesn't feel like a victory, but it really is. And now we have a very solid group of people who knows what's going on, who has been through there, who are veteran advocates. And that base of folks is going to be really important as we help to other people understand what is in this bill and connect the changes that are in the bill to what we believe is going to start happening. So we're going to start going through some things that people can do right now. Like I said, we had a press conference yesterday, and there was a nice article that came out this morning. I didn't have a chance to put it in my slides, but we'll talk about it, and I'll get you the article after the fact. It was a really great press conference at the Capitol, and we had a person with a disability who was talking about their experience as a person trying to, you know, use the program and fighting to get the things that they needed. We had two great benefit specialists from the counties who were, I mean, they were riveting for the press that was there because they were talking about the experiences that we know pretty well about who comes through the door, what the barriers are, how hard it is to apply, how long it can take, what delays mean for people. And we also had a small business owner who was talking about how her small business couldn't afford to purchase an employer-sponsored health plan and how her workers relied on the Affordable Care Act marketplaces and or Medicaid for their health care coverage, and how, that these changes that impact both the ACA marketplace and Medicaid really make her worry that her workers won't be able to stay healthy enough to continue providing care for families. This was a child care center business owner. So she was really articulate. As we all know, many of our home and community-based providers are in the same boat, small businesses that may be small enough where they don't have to provide employer-sponsored insurance. Even if they wanted to, they couldn't afford it. And um, understanding that their work is critical to families being able to go and to work themselves. So that connection of, this core care work is important for the rest of our economy was there. And we had some press there, and I think 7 or 8 legislative staffers who really learned a lot, because we forget that all the things that we are familiar with that are kind of part of our daily lives are completely unknown to a group of people who have never had to think about these things, who've never been on Medicaid. And in fact, the one of the benefits specialists actually printed out the Medicaid application, which is 42 pages long, and her sheet of here are all of the other things that people have to kind of bring to verify. And it just like people were flipping through that, and they had never seen it before, and it was a revelation for them how complicated our current system is. And then the idea of making it harder becomes something that can take hold. So this is another great time to really think about all of the things that you have forgotten that you do, because some of what we're going to talk about today is quantifying and helping people understand what is the work? So if you are a family caregiver, for example, all the time that you're spending to make your life work is probably stuff that if you weren't doing it, a paid professional would be, right? Um, if you have five different appointments that you need to figure out how to get done, you're coordinating care. You are following up, you are making appointments. And think about how much you have to do that and how much time that takes. How long do you spend on the phone, for example, with the consortium trying to get questions answered or correct billing mistakes or, get through the paperwork? For those of you who are caregivers, all of that time on your care plan where natural supports are doing the things, if there weren't natural supports, that would have to be care that was covered by the system. Um, and how often do you have to fill in caregiving gaps? This is all time that is unseen and in some ways undocumented. Transportation, I can't tell you how many times in yesterday's press conference people were reminded that many of the people who are in Medicaid are non-drivers, right? So you may be somebody who's making appointments, but you also may be the person who's getting them to where they need to go, whether that's a day service or a employer or a medical appointment. That kind of volume of care is largely unseen and undocumented by our system. Medication management. Many people are providing some pretty complex nursing care at home, meal prep, personal cares. These are all things that are important to kind of show how the system works now. And we've spent a lot of months saying, there are a lot of people that have kind of done a delicate house of cards. They figured out a way to make it work with the tools that they have. But if they get any less help, some of those things fall down. And we need to quantify what's happening right now to help decision makers know how delicate people's lives are, first of all, but also how little it takes, how these decisions that states are going to have to make will really make a huge difference, not only to people in Medicaid, but everybody who helps serve those people, who provides that care, including small businesses and care providers. And it's time also to revisit what would it mean if you had less help. Lots of people have personally said to me at least that this is the difference between me being able to work at all or not. And I think it's really important as we talk about this bill, there's some real assumptions, and we hear it from our lawmakers now as they're trying to spin what the bill does. There's some real assumptions about who's in Medicaid, what they're doing, and that, oh, none of these changes will have consequences for people in Medicaid. Those are kind of some top level assumptions that are made. And they're able to say those things, and some people believe them because a lot of folks don't understand that people with disabilities and older adults really struggle to get the care that they need, even in the robust Medicaid system that Wisconsin has. They assume that people with disabilities are taken care of. They don't see that what we see. And um, that lack of knowledge, is because of all of the work that everybody involved with the system, whether it's at the county level or the small business providers, all of the work that goes to just make things stable and make things work one day at a time kind of hides that we have a system, but it isn't necessarily that people with disabilities are taken care of. Um, and I think there's also room to kind of challenge that assumption that, you know, people with disabilities really want to have the same opportunities and the same ability to make choices in their lives as anybody else. That's really hard to do when you don't have, when you have to be in poverty. Um, Julio, I'm hearing you. Um, when you have to be in poverty to get the services that you need. So I think that when we think about our neighbors and our community members and our city councils and our county board members, you know, people who we interact with, keep in the back of their mind that they have an assumption that everything is okay because we haven't told them what it really takes in the current system to get some amount of care, even, and it may not be the entire amount of care that people need. We're going to ask for your help in the coming weeks. Part of what will be very impactful as we think about what does it mean to, say, implement prove your working requirements or prove you're exempt. There are a lot of things that are really unclear in this bill, and we'll talk about them. And a lot of people who don't necessarily neatly fall into exempt category or work category, lots of people who have what we would consider pretty common situations, but there's no decision and no certainty in the bill of how to handle those gray areas. Um, so it's going to be really important that we compile kind of the, well, what about this case? Or did you mean to include me here, or am I not who you wanted to include here? That can be really helpful, not only to help lawmakers understand that this isn't that clear, but to influence the people within the federal Centers for Medicaid Services, for example, who are making the decisions about what do you do about some of the scenarios that we know are pretty common. Um, and that's why I'm saying, like, we may have things that passed in this bill, but there are so many decisions about how do you actually implement that bill. And if we're successful in influencing some of those decisions, it really could change who those requirements apply to or not, and how people can document. And of course, I'm on the side of let's impact as few people as possible and make it as easy as possible for them to comply. This, we are thinking about a statewide survey. This is the one we threw together for today, and I think Beth was going to put in a link to it. But one of the things we're thinking about as an organization and as a disability and aging community, as a strategy, is to help people provide a perspective in an easy way that lets us hold up, you know, hey, we heard from 1,000 people across the state, and they're saying a lot of the same things. That becomes another thing to talk about. It becomes another thing that we can take to our state agencies, our federal agencies, our congressional reps to keep the conversation going. So we are kind of looking at how do we ask the right questions, and because so many of you have been engaged on this process for a long time, we're also thinking about what can you take to people that you know who haven't been as engaged? What's the easy way for people to start participating and start joining in this thing? So I'm letting you in on the strategy of why do a survey, but it is because we know we have to keep the conversation going, and that you have a lot of people that you've talked with in your life who may need some, may need something easy to do, or maybe need some understanding of what this bill, now that it's passed, really means to people. Our organization is also starting community conversations. Um, as part of our federal charge, we have a 5-year state plan, and it's time for us to be thinking about the next 5 years. I know that may seem like a really long time span. Like I can barely think about tomorrow, much less the next 5 years. But a lot of the changes in this bill will occur over the next 5 years. So we want to make sure that we're putting our efforts into the things that our folks are thinking about when they think about the future of Medicaid, the future of home and community-based supports, the future of, all of the things that make it possible for people with disabilities to have full and rewarding lives. Again, we'll have a survey. If you can't come, that's fine. These are virtual. We're having 2 of them, and Beth will put the registration links in. Again, we're thinking about how do we take what we hear from all of you and report it back as a, as a reflection of, people's true experiences and what they're worried about. We're also talking about, do we need regional sessions and other things? So I just want you to know that there are things happening now, but also strategy that we're thinking about in terms of how do we help our advocates to continue to be engaged and to really do things that might matter quite a bit as we go forward. So we're going to talk about some more action steps. If you've attended these presentations before, we've talked a lot about polling and how many people, even though this has been what we've focused on for 7 months now, I guess, that there are an awful lot of people who haven't really followed this bill at all, and they don't know what's in it. Lawmakers are part of that audience, by the way, even some of them who voted for this bill. And the other important point is, when people learn that this bill makes big cuts to Medicaid and the healthcare system and food assistance, the more they learn about it, the less they like it. So, we have a lot of audiences that we continue to need to talk to. There are some folks that are reporting back. They've been engaging with their members of Congress. Some members of Congress seem to be trying to say, well, I didn't know that that was in the bill, when they're getting some constituents who are pointing out things that are in the bill that's now law. Some lawmakers are really saying things that aren't true at all as a response to their constituents, or they are saying things that kind of are based on assumptions that they've made, such as, well, if you want health care, go and get a job, or none of these cuts will, result in any benefits being lost, or, some of those rhetorical narratives that we have heard before, frankly. And I think that those are all things that are being done because lawmakers don't really want to make people unhappy. They don't want people upset. And they don't want to be responsible for things that are negative in people's lives. It is time to be there and educate them about what is in their own bill and what it's going to mean. To show up and tell them, look, I don't believe what you're saying, and it is going to impact me. And frankly, if you don't know what is in the bill, you've got one job in Congress, to know what's in the bill. So I think it's always useful to make sure lawmakers know that you're paying attention. And frankly, we will talk about some other things that Congress may do. Lawmakers, if they hear that there's something that is not correct or wrong or needs to be fixed that just passed last Friday, they have the ability to change the law. That is what their job is. So we shouldn't forget that. We shouldn't let them say, I didn't know, or it won't hurt you, or it'll be implemented a long time, or it will only impact people who, if somebody loses their coverage, it means they were a fraudster. No. We also need to be influencing the people at the federal level who are now going to be making decisions about how to implement this bill. Um, there's a big audience of people who still doesn't know what's in this bill that could be, that needs to be informed, because the changes that are in this reconciliation bill are really going to start to impact a much wider group of people than just people on Medicaid and just people who serve people on Medicaid or get paid with Medicaid dollars. That's a huge group. There's also a huge group of people who will be affected who have Affordable Care Act marketplace plans, and frankly, anybody who uses healthcare. As more people become uninsured, it is private insurance rates that go up. So you kind of have a lot more roles now. As a public educator, you've started doing this, but it's even more important to continue doing it now that it is law. Now there's something tangible. There's a lot in print, not only the bill, but analysis, articles on the bill, and they're all kind of saying the same thing. There is a lot of opportunity for people to become informed. Many people don't know where to look. You might be the person who they're hearing about, these changes for the first time. And we encourage you to be your community Medicaid expert. You can educate at a backyard barbecue, at your church social, at your bowling league, at the meetings of your local disability group. These changes are really going to impact a wide group of people at every level. And it's important they know what's coming, because they can be part of helping make the best decisions to make the impact the least harmful for their workers, their healthcare system, and people like yourselves. So we always have provided a ton of articles out there that we gather throughout the week, because we're constantly reading new analysis, different things. Share those articles, but put a piece of yourself in them. And a lot of you do a really great job at this already. It's now no longer enough to share the link. It's important to put some personal perspective and context into your post. It doesn't need to be lots, 2 to 3 sentences about, hey, this thing that this article says, this really resonates because it is applicable to my situation, right? This really describes what already happens, or what I'm worried about, or whatever it is. So we'll continue to post those things and share those things and share a piece of yourself with them, because that is part of how we can outreach to more folks. This is a list of questions that we gave out last week, but I think they're still pretty good. So if you're talking to folks at your backyard barbecue, or by the lake when you're fishing in a boat and they can't get away from you or whatnot, these are the kinds of things that people who aren't necessarily in Medicaid might think about differently if they knew that they should. Awful lot of people, we have care infrastructure around now. There are already hospitals. I think there were a couple articles in Nebraska that are saying we are going to have to close, and we're doing it now because we see Medicaid cuts coming. And Medicaid is such a big portion of our operating budget that we know this many people losing coverage means that we can't continue to function. That's already being said less than a week after the bill is passed. I heard, I was on a conference call where there were some folks from Texas, who were already saying, yep, we're hearing from people that there are certain providers who are no longer taking people on Medicaid. The impacts of this bill are already starting. And when you start losing care infrastructure, then that impacts anybody who might need it, including people who aren't on Medicaid. And for a lot of folks, they may not need that care infrastructure now, but they may not be that far away from needing it, especially when it comes to providing supports in people's homes. And so kind of asking these questions, you know, is it important to kind of get people thinking about how their situation could change and what it would mean if it did. There are already starting to be some lawmakers that are repeating things in the bill that are not true, and they're maybe sending them out to constituents. That means that we have to keep repeating the things that are true, and we have to keep doing it at every opportunity. I've listed some of the things that have been said. Some of these are things that have been said publicly kind of multiple times. There are some lawmakers in Wisconsin that are saying some things about the bill that are not true. And I think that one of the things to remember is when people are deliberately saying things that aren't true, why do people lie about stuff? Because they don't want you to know that they don't want you to be mad at them, right? They're trying to evade responsibility. They're trying to convince people of a different reality so that what is happening is not obvious. And I think that it's important for us to remember that really why people say things that aren't true is because they aren't proud of what has happened and they kind of know, and they don't want to be held accountable for those decisions and those actions. So here's a list of things that you can put on repeat that are true about this bill and about what it means. Some of these numbers may change. They're going to go up. We'll talk about that. But I want you to have a list of things that are, I hope, plain language. We're always working to make things easier to say, but that are true and that do need to be repeated over and over and over again so that we're breaking through the bubbles to help people understand what this bill is going to mean for their future. It's also important to continue to be constituents. Just because your congressperson voted for or against this bill does not change that you are still their constituent. Whether or not they listened to you and what you said influenced their ultimate vote, there's going to be another vote. There's going to be another bill. There's going to be more decisions of how to implement this bill that you should expect your congressperson might be interested in influencing. And even though they may be disappointed you in how they voted here, that doesn't mean you change their expectations for accurate answers and for the lawmaker to fix the gaps that you're talking about. And here are some sample questions that you might ask your lawmaker. Maybe some of these scenarios fit you. These are all reasonable questions that are not answered by the language in the bill. And they represent actual realities of people that who we experience things now. So we've provided a list. You may have other questions. Let us know what they are, because we always want to, keep building out what are some of the scenarios that are real that lawmakers should be asked about. Um, here's another set of robust questions. Um, and I think that one of the things that is challenging with this particular big bill is that some of the messaging has been, well, if we just make an exemption category, you're fine. And that isn't true. We know that's not true. If you're trying to exempt certain people, they've got to fit into the category. And that may or may not be a real easy process, and they've got to prove it. So that's what I mean by the nitty-gritty details of who fits where and what do they have to do to prove is now the things that we should be asking Congress about, because they didn't write that stuff into the bill. And that may have been deliberate. There's an awful lot of shifting decision making to states or to the federal agency who's going to tell states what to do. And that means that Congress gets to say, hey, we just, we exempted you, but these other people made different decisions. And if you're not exempt, well, we tried. No, you are responsible, for the legislation and the laws that you write. And if they weren't well written and they're not doing what you intended, it is the lawmakers have the ability to go back and fix those things, or to talk to the federal agency to make sure that the people that they were intending to exempt are in fact exempt, and that it is easy for them to prove that they are exempt. Congress is going to be home for August. This is a great time, if you're not on vacation in August, as some people are, this is a great time to get in-district appointments with your lawmakers. It's time to really talk through with them how these programs work and why they're so valuable. You can talk about what is now law that this bill changed and say what you're concerned. There's all sorts of reasons that you could have really robust meetings here. And you can ask them to do stuff. You can ask what they are going to do to make sure that the administrative law rules or guidance that CMS issues is going to give states flexibility, or tell states, here's how we want you to do things so that people with disabilities and older adults and folks that you have been saying are truly vulnerable and we aren't intending to harm in Medicaid aren't harmed. And you can also ask them, hey, what are you going to do to make sure that nothing changes for me, that I don't end up getting less help? That's a valid question. The other thing that many of you have been really great about doing, and it's going to be a continual need, is engaging with the press. Yesterday's press event was a good reminder that even reporters who have really been following this piece of legislation haven't been thinking about, what does it actually mean now that it's passed? What are the next stories that are going to need to be told from a local angle? And I think it's important that now more than ever, we start, making sure reporters understand this story doesn't end because the bill passed July 4th. It's only beginning, because lots of the decisions that have to be made are occurring now and in the next year. And they're going to be impactful for local communities. Every change that happens between now and when the implementation date occurs is an opportunity for a new story that needs to be connected back to, why is the change happening? This bill. Really important role, not only for, people in your life, but for reporters to connect the dots for them. What is cause and what is the effect? and what does it mean for local people? A lot of you have been really engaged about talking with your clients, people who use your services. You've been talking with other disability groups or, groups that you're involved with. Um, you probably didn't realize you're doing some community organizing, but you are, and you're really good at it. And the thing about community organizing is it builds on itself. You've got a very strong foundation and a group of people and partners and lots of folks around you. You have never been alone on this, and you're not alone now. So this is a great opportunity now that there's something tangible in print to go back to some of the places you may have talked to before, to start answering questions from people with disabilities who maybe weren't paying as much attention or engaged, to start talking with your counties and other folks who are now going to have to figure out what all of this means. The more people who are engaged, the more people are watching, asking questions, and the more influence you can have on the outcomes that are going to be impactful. Okay. There's lots, we're going to start talking about what actually got passed in the bill and some of what Congress may do next. Lots of language is unclear. States are waiting to see what they have to do. And all of those things mean advocacy opportunity for us. I just want to be clear, this bill was passed, written fast, and it wasn't written well. There were no public hearings in the Senate on any parts of this bill. This bill moved from first introduction of full legislative text on a Friday evening to passed on Monday. It was amended multiple times in that span of days. The political reporters who were on the floor were reporting that literally changes were being made up to an hour before the final vote, and the Senate parliamentarian was reviewing changes that were written on post-it notes by legislative language. That gives you an idea of the speed at which this was passed. So we should be unsurprised that there are mistakes, there are language that is inconsistent, and that there are lots of things where nobody fully reflected and thought about, are there unintended consequences if we do this? In contrast, just to give you a perspective, when the Affordable Care Act was passed in 2010, that change to the law had, I think, almost a year of public debate. There were 5 different congressional committees that had hearings about part of that bill. And at the time, folks were saying that that bill was rushed. When we just had a bill go from we don't know what the full text is to it's passed, the one chamber, and it's enacted 2 days later, like I think that gives you a difference in how much speed happened here. And when you do things fast, you tend not to do them well. We're going to keep learning more about what is in this bill over the coming weeks, okay? There are drafting mistakes for sure that are now law. Lots of language is really unclear. It's really open to interpretation. There are attorneys that don't necessarily agree on what the interpretation is. All of that means opportunity for advocates, because there are a lot of things that are unclear. That means federal agencies are probably going to have to tell states what it is they need to do or where they have flexibility to make their own decisions. And it's always important to point out to Congress the flaws and mistakes in the legislation that they voted for and passed that are harming people, and especially people that they said they didn't want to harm. Because again, legislators and lawmakers, there's a reason we keep having elections because we don't assume we get it right the first time. They can go back and fix mistakes. We can ask them to do that. We can go ask them to say, hey, if you're going to do a second reconciliation bill, here's your next opportunity to take out all of the Medicaid cuts that you just made in July that aren't looking so good, right? Like always be thinking about how you can ask them to do more for you, and to correct the things that they maybe voted for that aren't turning out as they thought. So there are lots of decisions that are going to have happen in the next 18 months to 2 years and longer. The bill language does say what states have to do in kind of broad terms. It doesn't tell them how. So decisions are like, who really fits into those exemption categories? How do people prove they're exempt? All of that stuff. That's stuff that's going to be figured out in the coming months. And there may be some decision making by federal agencies like the Department of Health and Human Services. They can will tell states, hey, you can figure out a way to implement the bill or on your own, or here's how every state needs to implement the bill. There are some parts of the bill that give authority to federal agencies to determine what it is that they have to do. And in other places, there are going to be agencies that have to write formal administrative rules or guidance about what they think the bill says and what they think the bill must do. In the past, when agencies have had to write administrative rules which have the effect of law, there have been public comment periods. Again, if there is one, that's a great opportunity for advocates to say, okay, here are the real life scenarios that exist. How are you going to make decisions that, tell me what happens to this person, right? And a lot of times states also are in the position to have conversations with federal agencies. The states may, say, hey, we're hearing from a lot of people on these issues, and we have these questions. We have the same questions they do. So there's opportunity to influence behind the scenes as well. You can be part of all of that. And because there's so many things that are unclear, that does mean that states don't want to make some of these decisions until they know what the federal agency is going to require them to do. They don't want to spend money on changes that end up not being okay. I wouldn't want to invest in a big fancy new technology system if I have to spend more money on doing the things that I put in the first time, right? So there's some amount of caution states have, but that doesn't mean we're waiting on the advocacy. It means that this amount of caution, remember, every delay is a victory. This amount of caution that states are, in my opinion, rightly saying is an opportunity for advocates to increase the volume of things that need to be considered as the federal agency is figuring out what to do. Now, there are some things that there's some risk to this, right? Because the longer the federal agencies take to decide things, the less time states have to make decisions. Another great reason why it's important for advocates to continue to be engaged all the way through, because you don't want to wait for a federal agency to make a decision that you may or may not like, and then have the state have to respond to that in a short period of time. You'd rather have some really substantive conversations and influence at the state now, so that when they do have to make decisions quickly, they already kind of know, here are the things that are going to be important to address to make sure that whatever system we're upgrading is easiest for the workers who have to help people through an application or verification or renewal process. And it's easiest for the participants to use and understand, okay? This slide kind of repeats what I just said, but it is important to know that the people who wrote this bill don't appear to have a great understanding of the complexity of Medicaid. And they don't appear to have a great understanding of how states have set up their Medicaid programs, because each state has done very different things. So that means that there's a lot of nuances that are specific to each state or real life scenarios that this bill hasn't thought about and it hasn't considered, because the people who are writing the language didn't know that any of those things were true. They're not Medicaid experts. There are people who are making policy decisions that they think will impact Medicaid in a certain way that they have in their minds, and they may be wrong. They may the changes they made will likely impact far more things than just what they had in mind. And again, that's another opportunity for advocates to, talk about what is it that you have done and why it will or will not work in the way that you thought. There are a lot of implementation deadlines for various provisions in the bill. They are all different from each other. So there are going to be waves of impact over time. The implementation deadline is really when something has to be live and in effect. So when you see a deadline of this needs to be operational by December, by January 1st of 2027, that kind of sounds far away. Psychologically, it feels like that's 2 years away, but we're 7 months into 2025. So that's less than 18 months away, first of all. And nobody knows what the rules are of what they're supposed to be doing. And we have all these decisions. So I use that as a date because even dates that seem like they're far in the future, and we certainly hear lawmakers say, oh, well, the implementation is far away. No, the decisions and the money and the spending that states have to do to be able to successfully launch something and have it go in effect are happening now and in the coming months. They're not happening December 31st of 2026. They're happening far earlier than that. And there's just a lot to figure out between now and then. And as an example, two implementation stories that have, impacted our communities. After the Affordable Care Act passed in 2010, that legislation, I believe, gave the federal Department of Health and Human Services 4 years to get together the system that was going to enable people to go on and easily purchase their ACA marketplace plan. I don't know how many of you remembered that 4 years, the marketplace.gov website was launched and it crashed. It crashed and burned. It was spectacularly unsuccessful. And that just tells you that 4 years to get to a place where you launched and it was not seamless. This is a lot less time in this bill for most things. Similarly, the home and community-based settings rule that came out in 2011 and it's still not fully implemented. We've had things that have gone years where there's been a lot of time. This bill really doesn't give states much time at all for the complexity of what they're being asked to do. So if you think about some of the provisions in this bill, we're giving you less than 18 months potentially to figure out all sorts of questions and have it launched perfectly the first time 18 months from now. That is unlikely to happen. That's just not how most of us have experienced systems working. And even in this state, the unwinding process, that was a huge administrative task. Largely, Wisconsin did really pretty well compared to other states, but 300,000 people still lost their coverage. Again, the medical assistance purchase plan, I think last year, they were reinstituting premiums because they were supposed to. And the first time they tried to do that, the system wasn't prepared for all the people that were trying to do the right thing and pay their premiums at the same time, and it crashed. EVV, remember that? A lot of you probably are using that. They delayed the implementation of EVV for 3 years because there were so many different issues that needed to be worked through on how do you actually do what Congress is suggesting. So anyway, these are all things that maybe are part of your personal experience, and they're reminders to your congressman of how important it is for things to be done right and accurately so that people who don't lose coverage who shouldn't. Here are some examples of some of the kinds of decisions that either the federal agency or states are going to have to make in the coming months. It's a lot. I'm not going to walk through all of these things, but it's kind of like, whoa, that's a wall of thinking that has to happen. And it should be that people who are in the programs and know what the current barriers are and know how they would make their lives easier, are involved in making these decisions. The people who do the work, who see how folks get tripped up over and over again with the same things. Get in the back of your mind that not only are you thinking about how do we implement the provisions of this bill, but this is an opportunity to actually address some of the things that are janky and clunky and that are unnecessary that we hear about from people often in terms of how do we move through the process. It would be useful to not only figure out the questions that people need to have answered to implement the new law, but to do that in a way that kind of fixes some of the administrative issues that we already have. I mean, remember, we have a workforce out there that's helping Wisconsin to stay accurate in terms of who's eligible. Lots of people, there's a tremendous amount of workforce. Anything that we can do to make the work actually easier means that we're saving counties and others time. We're saving, perhaps reducing the amount of money that it might take to, serve more people if we can serve them better. All things that are worth doing right now. And there already are some articles out there that are saying, hey, these timeframes are not going to be likely to result in a seamless implementation. So some of the things that we have seen before, like websites that don't load or tell people they're not eligible when they are, these are things that could very well happen because it's pretty hard to create a system in a short time that works flawlessly the first time. So if you need an article to share, here there is one here. Lots of state budgets are looking at provisions of this bill and are pretty worried that they're going to end up with budget holes. Remember, we passed our state budget just before Congress passed this bill, and we made sure that we had budgeted for the things that we needed to. State budgets have to be balanced. That is not true of the federal government. So whenever the state budget doesn't cover actual costs, and that can mean like you get less tax revenue in that you were expecting, or in this case, federal funding that you were expecting to come into your state isn't there, or you have new costs that weren't included in the budget, that creates a hole. And when that happens, there the legislature has to get involved to keep the budget balanced. And they may have to come in and do, say, like a budget repair bill where they're making decisions and changing the budget, making cuts to programs or raising revenue or both to make up that shortfall. And sometimes they may have to come in and say, okay, there's a cost that we didn't plan for in our budget. Do we have the money to cover it? And if we don't have the money to cover it, then what kind of changes do we mean in terms of cuts or revenue to get it done? This is a possibility that can happen multiple times as we learn more about what the federal changes may mean. Our state legislature, if there's a budget shortfall, is going to have to figure out how to deal with it. Or if there are expenses that they haven't planned for. And it is likely that this bill will do both of those things. Not quite sure of the timeline, but it could happen this budget cycle. It could be a part of the conversation for the next state budget cycle. This is going to keep happening in waves if the law remains the same. And just the last thing, I want to scare people, but Congress is still working, and there's lots of opportunities here where more cuts could be made or more changes could be made. So we talked a little bit in May about what the president thought would be a good budget for the next 2026 fiscal year. Congress is working on that budget. There's a deadline of September 30th to get it done. And we've certainly seen Congress have arguments about cutting things or federal funding in those discussions. We also have an administration that has not paid out all of the money that has been appropriated for 2025, and we'll be asking Congress to let them not spend those funds. And we are also hearing from a couple of members of Congress that there's interest in doing up to 2 more reconciliation bills as early as this fall. So you could do 1 reconciliation bill per fiscal year. The federal fiscal year begins October 1st of the year. So that would mean that you could do a reconciliation bill as early as October 1st if you wanted to. None of this is set in stone, but it's all things that we have to watch. And certainly if there are additional cuts to federal funding, and we are seeing some of that happening either from the administration or from Congress, that adds on to what the impact is of this bill, at least in terms of state budget process. All right, so there's some links on here. If you want to read the full legislative text of the bill, that's the first link. And I've also included 2 pretty good summaries from Family USA and KFF that go through at least the healthcare parts of the bill, the things that impact Medicaid, Medicare, and Affordable Care Act. So for other states on the call, like I'm not going to be talking about a lot of the things that only impact expansion states because Wisconsin isn't one, but these are 2 really good resources that will tell you all of the provisions and what happened. Big picture. What's this bill mean? The Congressional Budget Office had an initial estimate that said $1.2 trillion is coming from healthcare, and $1 trillion of those cuts are coming from Medicaid alone. They also estimated 12 million people, which is 1 million more than the House version, would lose insurance. Now, that's an initial estimate, and the bill language changed multiple times before the CBO could do any more analysis. So they will be doing an analysis of the final bill. There's not a timeline on that. I just would throw this out here that this initial estimate, these are pretty big numbers. You should expect these numbers to change and go up. There are other folks that have done some estimates as well, trying to figure out, okay, if these provisions go into effect, what would it mean for states? A couple different models to share. This one is from KFF, which is really a leader in healthcare policy. I pulled up Wisconsin's note here, but if you're from another state, they did an estimate for everybody. They say that'll mean 10% less Medicaid funding for Wisconsin, or a reduction of between 6 to 10 billion over 10 years. And that range is pretty wide because, again, depending on what decisions states make, it can mean deeper cuts or fewer cuts. And that's something that, when I say our state currently, we have a governor and a Medicaid director who's trying to do the least amount of people losing coverage, if that may not be true in other states. So the only other thing I would point out is when you're cutting the amount of federal money that's coming in, that doesn't mean healthcare costs are going down. So the dollars that, 10% less money 10 years from now is going to buy you a whole lot less care than it does now. Here's another model. Manet is a Medicaid financing model. They've done a couple of different things. And they have an estimate for every state as well and a bunch of tables. They estimated the Medicaid cuts would be more than 1.2 trillion. Okay, that's a little different than the CBO. Notice the number isn't smaller, it's larger. And they think that the Senate bill cut about 100 billion more than the House version. Their adjustment for Wisconsin is a little bit different. I think these three things taken together show you the scale of the cuts. Even though the numbers don't exactly match, it kind of doesn't matter because there is agreement about the scale and scope of impact. And of course, this analysis doesn't reflect the final language of the bill either because it passed so fast. So be comfortable that these numbers are going to change, but all of them are showing big federal Medicaid cuts that impact every state, including Wisconsin, and that they're coming with, a variety of provisions in the bill. So we've spent a lot of time in this state talking about prove you're working or prove you're exempt requirements. Here's what ended up in the final language. Lots of these bullets we have talked about before because we were tracking what was in the House bill, what changed in the Senate. This tells you what ended up in the law. And a lot of them are the things that you've heard about before. Yes, the working age was expanded. It applies to a lot more people. It applies to adults with children over age 13. There are some exemptions that are unclear about who fits into them. You have to prove that you meet the criteria as an eligibility requirement to Medicaid. So all those people who are working really hard to help people apply and get into Medicaid, well, now they have a new threshold that they have to meet in addition to income and asset and potentially functional screen. If you don't meet the requirements, you lose your Medicaid, and no, you aren't eligible for ACA marketplace exchanges. Implementation. There is a date in here. It says January 1st, 2027. It actually says December 31st, 2026, but the first day after that is January 1st. Allows the states to do it earlier. I don't think Wisconsin is going to do that, especially since they don't know what the federal department's going to want them to do. And it allows the states to apply for a waiver that can be revoked at any time from the federal agency to extend that implementation to 2028. So when I look at that, January 1st, 2027 is the hard deadline in the rule, and you might get a little bonus time, but it's not guaranteed. And federal agency doesn't have to tell states what to do until a little over a year from now. So if you were thinking about implementing by January 2027, you would really have between June 2nd and the end of the year to do that. Okay. I'm going to fly through these, but these are some of the things that our federal lawmakers have been talking about when they talk about work requirements. If you want healthcare, get a job. And of course, we know that that is not necessarily something that's provided with jobs. We also had the Department of Agriculture secretary suggest that everybody who is able-bodied and working age could just go and get a job in, to labor in the fields and other places that many immigrants are now not being reporting to because of their fears of immigration raids. Um, Again, assumptions about who is in Medicaid. Those folks that are able-bodied in Medicaid, most of them are already working, or there's a real reason why they're not. Caregiving, too sick, other things. So I just put these in here to kind of illustrate that some of the rhetoric you're hearing from some of the people who voted yes on this bill or are in the administration may not match your experience. Here are some really hard questions that you can ask to your congressional delegation and CMS, specifically about the work requirements. So I've put the language from the bill about what they call them community engagement, proving you're working or exempt requirements, but they call it community engagement in the bill. And this is what people have to do. 80 hours of some combination of those four things in the green column on the left. But that provokes a lot of questions about what counts as those four things. And what's the responsibility of employers to help people prove that they have worked those hours. There's also a lot of questions from the idea of how do you prove that you've made those requirements if you are a contractor or a gig worker, or that you may be the person who's generating the invoice to document the hours that you've worked. I'm not going to go through all of these, but you may have additional questions, but think about, this is how I want you to think about the flavor of, here's the requirements that seem like they're fairly straightforward in the legislation, but when you really start thinking about, well, what does it mean? Like what counts as work? What counts as community service? And how do I prove it? That these questions get really complicated fast. I've also done the same thing here for some exemptions that are included in the final language of the bill. We've spent a lot of time talking about exemptions for caregivers because there are so many people with disabilities and older adults that rely on family caregivers to deliver part of their care. So the language that's in the bill is in that green column. And then here are some questions about who is included in that exemption. What do I have to prove to be able that I fit in that caregiver exemption? And I think all of these and maybe more questions are appropriate for your congressman at this point. And if they tell you, well, federal DHHS will figure that out, ask how they can be a part of, helping them navigate to make sure that those questions are answered and as many people can claim that exemption as possible. This is the exemption language that is applicable to people with disabilities. So when the lawmakers tell you, well, people with disabilities won't be affected, this is really what they're pointing to, that, well, we have an exemption from the community engagement work requirements, so you won't be affected. We've always known that this alone doesn't mean that people with disabilities won't be impacted, since the bill itself has so many provisions that are going to create giant state budget holes, and that some of the services that we rely on most are expensive and optional and in the biggest part of what most state budgets are, which is Medicaid. But look through and see if you think you would fit into those exemptions. And then think about it a little harder, because sometimes it isn't clear what fits into, say, a disabling mental disorder. How do you prove that you have that? What happens if you have a person who doesn't have access to health care, who then can't get into a doctor to have a diagnosis? And we heard a lot from our county workers yesterday about exactly that kind of scenario happening now, where you have people who have acquired a disability, and through accident or something else, they're waiting for a disability determinants, which can take years, and they don't have an ability to really get in and get a diagnosis because they can't afford it or they can't get into the care because they don't have insurance. This is a reality scenario now. So again, ask the hard questions and the detailed questions because they're going to really matter to a whole lot of people. Lawmakers think that they took care of things for you by including this language. And I feel like there's an awful lot of people with disabilities who probably are going to be left out from that exemption. And that would mean that they would have to prove that they were meeting their 80-hour community engagement requirement or lose their Medicaid. Eligibility determination, really the same language that has been consistent throughout both bills. For Wisconsin, this is applicable to childless adults in Badger care only. So it isn't applicable to all Medicaid programs potentially. And there is an exemption that was included for people who are receiving SSI benefits. Again, many people in Badger care are folks with disabilities who are waiting on that disability determinants, which can take up to 4 years to get. So there are definitely people with disabilities, lots of them in Badger care, who certainly will not fall into that exemption. Retroactive coverage, a little bit of a change from earlier versions of the bill. It still reduces the amount of time that people can look back and get their medical bills covered before they were officially approved to be in Medicaid from 3 months down to 2 in Wisconsin because we're a non-expansion state. In expansion states, you only have 1 month. And yesterday, again, our county workers were very articulate about explaining why that's such a big deal, that there are lots of people who have a delay in their application for all sorts of reasons, some of them which aren't their fault. And meanwhile, they're not covered and accruing bills that they can't pay. So this is a big deal. Even if it seems like, well, 1 month, what might that matter? If you've got medical bills that are in the tens of thousands of dollars or up, it's that can't be covered just because your application date, didn't go through at the right time. It is a big deal. And there are some changes that were made to the provider tax. Wisconsin as a state had a pretty low provider tax. And remember, our state budget raised it up to the maximum just before this bill went in to capture all of the money that we hadn't been before. So we have done what we can to use this provision now to get in as much money as we can. Other states have much higher provider tax rates and will be required to step them down, which means they will get less and less federal dollars and not be able to use those dollars as part of their required state match for Medicaid. So we can't, the bill prohibits our state from imposing any new taxes on providers than beyond what we already have in place. This was our one shot at it, and we did it. There are parts of 3 administrative rules that are being suspended. 2 of them relate to making it easier for people to apply and get into the Medicare Savings Plan, which is the program that serves people who are eligible for both Medicaid and Medicare. It pays for the things that Medicare doesn't with Medicaid dollars. So co-pays and cost shares, it can be really important for low-income people. And a lot of people with intellectual and developmental disabilities and low-income older adults use that program. So the final language doesn't suspend the entirety of those 3 rules. It suspends lots of them, lots of the parts of them. We're still teasing that apart. Overall, I think that what is important to know is the rules that were intended to make things easier for people to get or stay in Medicaid have been tweaked so that some of those reforms are not going into effect. There were a couple of new items added to the bill that do not matter. And they were added to the bill really as a response to kind of provide cover for lawmakers who were voting yes on the bill, that they had addressed concerns that they had heard from constituents. One of those things that was added was probably in response to people with disabilities saying, hey, we're really worried about what these big Medicaid cuts are going to mean for home and community-based long-term care. So the bill added a new option for states who want to offer home and community-based services to people with non-institutional level of care. Family Care, IRIS, CLTS, those are services that home and community-based services that require an institutional level of care. There is a huge population of people who could use some long-term, like in-home support that doesn't have an institutional level of care. So on the surface, this seems like not a terrible idea in terms of it does recognize there's a lot of people who need a little extra help. However, it's not going to happen. And the reason why is because it dramatically expands the number of people who would be eligible for Medicaid under that kind of waiver. And if you add a whole bunch of people that you aren't serving now into Medicaid, it means your Medicaid budget goes up. And home and community-based services are some of the most expensive things that we do. By the way, we also have a population of people receiving home and community-based services who does have an institutional level of care. And you need to be serving those people equally well, in addition to the huge new group that would be eligible that needs some supports as well. So at a time when many provisions of the bill are going to mean huge, huge federal spending cuts for states, it is really unlikely that states are going to say, you know, we are going to do a waiver that's going to add more people into our system and add some of the more expensive care that is still optional under federal law for us to do. And to just give you an example, I pulled this table from our friends at the Legislative Fiscal Bureau. This is what we spent in 1 year on items that are related to long-term care. And two of those items are home and community-based, like family care and IRIS and children's waiver, and one is facility-based, nursing homes, and then personal care and home health. Those are independent services, but they really serve the same people, right, who are in those programs. It's a lot of money. 9% of our Medicaid population in Wisconsin is in long-term care, and that's 41% of how we spend our Medicaid budget. So do you think that we're really going to add another waiver that's going to expand a population of people that is, the most costly at a time when we need to cut our budget? No. And adding this waiver doesn't do anything to prevent cuts to the current home and community-based programs that people rely on. So a big nothing burger, as far as I'm concerned. Here's another gesture. Rural hospitals were screaming that, hey, doing these things, especially the provider taxes, and especially doing things that's going to cost people their Medicaid coverage when that's a good part of our operating budget, that's going to mean we're going to go out of business. We're going to have to close. Well, that was heard, and they put in a $50 billion fund that allocates $10 billion a year for 5 years to prevent rural hospitals from closing. Well, that sounds nice, except there's 1,800 rural hospitals, so that works out to be a little less than $1 million a year per hospital. 5 million, even over 5 years, $5 million is probably not going to be enough to offset the amount of revenue those hospitals will lose, right? And especially if states cut their Medicaid programs or Medicaid patients lose their coverage, those hospitals are going to have much higher uncompensated care costs that are going to exceed the $1 million they might get from this fund. Um, just an example of, okay, the lawmakers are trying to look responsive and give themselves coverage, but what they did actually doesn't, in any meaningful way, address the problems that they're creating. We've talked about how the bill really relies on people getting tangled in red tape and paperwork and losing their care. That's how this bill saves money. Another article for you to share. Marketplace. What's in the final bill? Fewer provisions, but impactful ones. Here's what they are. This is again is a strategy to make it harder for people to stay in or enroll in Marketplace. You can see that some of these changes go into effect right away, some of them next year, some of them 2 years from now. One important thing that wasn't included in the bill was an extension of the current subsidies that keep premiums low. And that omission means that starting in November, people are going to start seeing what their premiums are going to be in 2026, and they're going to be significantly higher. Insurance companies are trying to set their rates for next year now. And the first notice that folks will get about their premiums going up is in November. So if you're thinking about connecting this bill to that change, that's an opportunity because they did not include the money. They included the money for a lot of other tax cuts. They didn't do it for this one. And that means that healthcare costs for people who are in ACA plans are going to really start increasing in the next year. For some of you who might be on Marketplace plans, you can use an online calculator to kind of see what that increase might be. We were just talking to a person with a disability who right now is paying, I think, $150 for a Marketplace plan. She did the calculator and it was going to go up to $450. That's a lot. And it depends on where you are as to how much it goes up. But the reality is that a good portion of people in the Marketplace are also people who are at 150% of the poverty level or less. And in Wisconsin, that's certainly true because we didn't expand Medicaid. So if you're above 100% of the poverty level, you are not in Medicaid, you're probably in the Marketplace. A lot of folks are predicting that this is going to lead to people who can't afford the higher cost and that those people are going to go uninsured. That will make, again, premiums go up for everybody else who's still in there. SNAP, what got in the final bill? Lots of things are similar to what we've talked about before. This is a little weird. Wisconsin has a low error rate, so right now we would be in the 0% match category, but error rates fluctuate all the time and they have nothing to do with fraud. They're mistakes. So it's certainly possible that you could end up unexpectedly being bumped into the 6 to 8% error rate and have a whole bunch of money that you didn't expect you have to pay. There was a provision that almost rewarded states with very high error rates. Specifically, Alaska has the highest error rate in the country. And there was a provision that basically exempts them from having to pay a match if you have a high enough error rate. So it's an odd thing that almost creates a perverse incentives for states to at least temporarily have an error rate that's super high to avoid having to pay the match. But for states like Wisconsin, who have always been pretty good and pretty accurate and have low error rates, it significantly means it's a risk for us to keep, to not have our error rate either stay low or maybe we just say, heck with it, we'll have skyrocket. 5% match of SNAP, it's a 1 point something billion program. So it is a significant amount that states would have to outlay if their error rate fell into one of those categories where they had to pay a match. SNAP also has some changes to its own version of prove you're working or prove you're exempt requirements. The thing I'm going to flag for you is there's no implementation date specified. Why is that important? When they don't specify an implementation date, that generally means the enactment date when the bill was signed becomes the implementation date, which was last Friday. States are really confused about how they're supposed to be retroactively in compliance with a whole bunch of changes that really mean an expansion of who is considered in those working requirements. So they've been asking questions. This looks like an example of a mistake in the bill, but it tells you how important those mistakes can be in terms of what states are supposed to do and what people are supposed to do when these changes go into effect. Most of the other provisions we've talked about with SNAP remain the same. So some really significant for Wisconsin, reducing the amount of federal money, match money for running the program down from 75% to 25% in 2027. That's a huge drop. And again, our counties are really the ones on the front line who are doing a lot of the work on that. Waiver restrictions, that's also extremely impactful. It means there are several counties in Wisconsin who have been exempted in the past because there just isn't a volume of jobs that those counties have that would let people, work. Though those counties are going to lose those waiver exemptions, which means there are going to be more and more people who are required to meet the work requirements. 5 million people could lose all or part of their SNAP in this country. There are, again, lots of national estimates going out there. The Congressional Budget Office estimated that the work requirement alone would mean that 2 million people would lose food assistance entirely. Another kind of independent analysis said there's actually a group of 5 million people who will lose part or all of their benefits, including about 40,000 people in Wisconsin. If you're looking for an overview of SNAP, this is a good article. I think the important piece to know, this is true for Medicaid too, is this bill makes the largest cuts to both Medicaid and SNAP ever. It's very, very deliberate and focused on those two programs. And as a reminder, there are 53 million people in the country who rely on SNAP, and many of them, in fact, most of them, are also in Medicaid. So that means many of the people that we know in Medicaid may be in a position where they may lose both their health insurance, their health coverage in Medicaid and food assistance, or one or the other. And that's double impact on the same group of people. I'm going to go through really quickly. These are articles that just have them in your stash of things you are going to share on social media. Maybe there are different people in your life who, will pick up on these different messages. Some of what we have to keep doing is just finding different ways to highlight all of the many impacts of this bill. And chances are, because there are so many impacts to this bill, you will find people who are learning something from you that they didn't know, and it's going to be about something they really care about that's going to be impacted by this bill. So we talked earlier about, hey, post an article, read it through, your personal perspective on it. Here's a whole bunch of them that you can share. Here's one about people who are going to be impacted by the prove you're working requirements and what it means when you lose insurance. Here's one about people who are actively sick and may be subject to the work requirements and what that would mean if they couldn't meet them. Here's one about a family caregiver in Missouri who has left the workforce and is caring for a person with a disability and her older parents, and is sick herself, who is not sure how she is going to be able to meet the work requirements and how the caregiver exemption could fit for her. She is a paid caregiver for her son in Missouri. And here is a opinion piece that I think is worth sharing about what these collection of changes might mean for people with disabilities, in terms of providing less of an opportunity for people to be fully included in their community when really they need more. To conclude, our job now is to connect the cause of what is happening, this bill, to the effect: cuts, increased costs, changes, administrative changes, more workload for people, for counties that people are going to start to feel. This is going to wrap over waves. There's a lot of opportunity to influence each stage of the process, and we're looking for ways to kind of help you keep getting those messages out there and find ways for you to help influence what is coming next. So stay tuned. We're going to be at this for a couple of years, and all of the work that you've already done has been extraordinarily important, but we have a lot more to do that can really make a difference in terms of how these cuts and this bill impacts Wisconsin. And I am going to stop now. Are there any questions? That was a lot of information.
There were lots of questions, but I think that you've answered everything pretty thoroughly, and Beth and I captured lots of it, but I think most of them were all in your presentation at some point. So
yeah, thanks to everyone. And as you leave, you should get a survey. We would really appreciate if you would fill that out.
All right. Thanks so much, guys. We will send the recording and the links and things to those who registered later this afternoon.
I'm just looking through the questions, folks.